Other than anticoagulation, what are the other treatment strategies for DVT? Of course, anticoagulation is the fundamental treatment of DVT, either unfractionated heparin or low molecular weight heparin, later on shifted to vitamin K antagonists orally like warfarin. The second important strategy is to see that the venous flow continues and increases. This can be ensured by elastic compression stockings and by elevation of the limb and limb exercises. Clot dissolution may be required in certain cases where the long segments of the vein are showing the DVT. Thrombolysis by streptokinase, recombinant TPA is recommended. Catheter thrombolysis, that is introducing the thrombolytic agent into the vein via a catheter, and also placement of inferior vena cava filters to see that the DVT thrombi will not get embolized into the lungs. These are some of the other modalities of treatment that we can offer to a patient of DVT, in addition to the anticoagulation that we have already discussed. Along with anticoagulant treatment, compression stockings for the lower limbs are a part and parcel of the management of deep venous thrombosis. There are two types of situations. One, when the patient is admitted as an inpatient and is bedridden, either due to surgery or ICU admissions or any cause, wherein prolonged stay in the bed for more than 3 or 4 days or longer is required. In such a patient, particularly the elderly, it is imperative for us to take care of their legs and see that they do not get deep venous thrombosis. For this, what are called the TCS stockings or the electronically compressible stockings have to be placed on both the lower limbs and see that the muscle pump is activated every few minutes, and then the circulation in the lower limb, in the veins, is maintained. So much so, the deep venous thrombosis is prevented. The other type of patient is the one who is ambulant patient, who is not bedridden, but who had deep venous thrombosis or who is already a known case of DVT. In such a patient, it is essential for them to wear compression stockings right from the toes up to the level of the knee, and sometimes if the deep venous thrombosis is in the upper thigh, maybe up to the level of the hip, to wear compression stockings. These compression stockings will help them in venous circulation and prevent any redundancy and stagnation in the lower limb blood vessels, particularly the venous thrombosis occurrence is prevented by these stockings. So this is how we have to take care in addition to giving the anticoagulants. This is a final slide showing the take home messages on DVT. DVT with its attendant complication of pulmonary embolism together constitutes what is called venous thromboembolism. These are fatal diseases and one must have high degree of suspicion to diagnose these conditions. Pretest probability score must be obtained in all patients where there is a clinical suspicion of DVT or PE. D-dimer test must be done in all cases of suspected DVT. Low molecular heparin is the choice rather than the unfractionated heparin if the patient can afford the cost. Outpatient treatment is the answer, and it is the most cost effective treatment, and no need to admit a patient of DVT today. Compression stockings for at least 1 year should be worn in all cases of DVT. Pregnant women with DVT is a tricky group. The diagnosis is sometimes infix, the treatment issues are difficult, the anticoagulation rules are little different, so it's a specialized area, pregnant women with DVT. Anticoagulation for at least 6 to 12 months must be continued. Long-term use of LMWH is safe and it is efficacious. Remember, we need not worry about the risk of bleeding that can occur due to anticoagulation. The benefit that we offer to the patient is much higher than the risk associated with anticoagulation. With these few words, I conclude my talk on DVT. Remember, we have not touched upon the other important entity called pulmonary embolism, and those of you who are interested to read more or refer to the references given so that you can go and churn more information on both DVT as well as PE. Thank you very much. For those of you who are interested in additional resources on DVT, I recommend you to see the following references. The first reference is published in the Canadian Medical Association Journal, October 24, 2006, which is a review article on deep venous thrombosis. Our presentation is taken mostly from this particular review article. Of course, the other sites where you can find valuable information on DVT is www.legdisorders.org and www.emedicine.com and the other references which are listed here. Hopefully, some of you are interested in pursuing further about this particular problem would be able to get at these resources and see some more information there. So, doctors, with these few words about deep venous thrombosis, I am closing my talk for DVT with a reminder to you all that we will be meeting for our next CME program on the 20th of April.